Hey guys, it's Dr. J, and today I'm going to talk to you about cervicogenic headaches. So, in addition to specializing in natural human movement, sports injuries, and the musculoskeletal system, we also treat cervicogenic headaches. Cervicogenic headaches are very common, and we see them pretty often. Cervicogenic headaches meaning that they start in the spine, they are muscular induced, and they are influenced by abnormal joint mechanics. So cervicogenic headaches, they often are a result of abnormal postural defaults. They can be due to a history of cervical trauma or previous injuries to the cervicothoracic region. They may also be a result of just abnormal stress. So stress that you kind of live with maybe day to day, stress that just sits at the suboccipital region, radiates into bilateral shoulders and to the upper traps. Patients oftentimes complain of constant headaches, sometimes even on and off, headaches that may be worse with movement, so kind of rotation, or even side bending, or even looking up may be painful and reproduce those symptoms. But also patients may complain of stiffness, just limited range of motion, as a result of the muscular deficits in the cervical region from those headaches. Some of the headaches may be exacerbated with having abnormal postural defaults. So the classic posture that we commonly see associated with these headaches would be more of that forward head, kind of rounded shoulders, slouched upper T-spine kind of position. So in this position, you can see that here, that's going to influence quite a bit of the upper traps, influence quite a bit of the suboccipitals, creating quite a bit of tension in the levator, creating stress on the rhomboids, and even shortening your pecs and creating some stress in your sternocleidomastoid muscle there. So from a spinal standpoint, looking at joint mechanics, patients that suffer from cervicogenic headaches, a lot of times they are those that may live sedentary lifestyles. They may have desk jobs, so they're sitting a lot all day. And if they're sitting a lot throughout the day, they fall into more of that classic forehead, rounded shoulders kind of position. And so with that, their pelvis is excessively tilted posteriorly, and when that happens, that draws your thorax forward right there. So you have a reverse of that lordosis in the L spine. That creates quite a bit of stress here in the scapular stabilizers there because you're just drawn forward. But even so, with this kind of position, with an effort trying to keep your eyes above the horizon here, you're going to lift your head up, and when that happens, then the patients will actually compress more of this mid-cervical region here, and when that happens, they actually close down on those facets there on the borders of the cervical spine. So you can imagine in that position, just that forward head, excuse me, rounded shoulders kind of position, that leads not only to cervicogenic headaches, but to quite a bit of issues there in the shoulder regions as well. So some common issues associated with that may be shoulder impingements, back pain, thoracic stiffness, or just lumbopelvic issues there. But looking at all of that, in general, this is just a brief overview of cervicogenic headaches. So we would routinely kind of screen for other systems just to make sure that nothing is contributing to those headaches, because there's other diagnoses that also influence those. So There's proper screenings need to be fulfilled throughout that examination. But today I'm just going to talk to you about some kind of go-to exercises that I like to start off with as a base. So the first exercise I'm going to have you do is going to be a lacrosse ball release. The lacrosse ball is actually a bit firm and dense. Much more denser to use as if you were to use a tennis ball, which still might work, but you can get the lacrosse ball from Academy or order it off Amazon. So the lacrosse ball release is more of a technique that you'd use like a self-massage technique, and you would use it on those muscles that are prone to that tightness. So here you've got your upper traps going from your shoulder here all the way up into your neck region. So that may contribute to some of that tightness, some of the headaches that you're having, but also tightness in that levator muscle there. May be a good point to use this lacrosse ball. So using it, you'll just place the ball on the wall and then find the muscle, which is the upper trap, and you can do this separately, but do the levator separately. You would just take the ball on the wall, roll it. As soon as you find a sore spot, the tender areas is what you're going to focus on. Once you're on one, you can simply maintain pressure to allow that to do some work for you, waiting for that muscle to give. And then after that, you can go side to side, go up and down, sort of massage this general area. So you should feel somewhat of a soreness, but somewhat of a sore feel-good kind of sensation with that. So that's going to be good to help that muscle to relax. Locating your levator is just going to be at the medial border of the scap. You'll go and find that sore spot and do this the same way. So just find that sore spot, stay on it for a good 20-30 seconds, hold, and then massage it, going side to side, up and down for about 2 to 3 minutes. Okay, so doing that every day will definitely help. Aside from the lacrosse ball release technique, I like to go into upper trap stretch. So you're just sitting there, make sure you got some good posture, sitting up nice and tall. And if you're stretching your right side, you're gonna side bend your head to the left. You may feel a stretch with that, but for an added stretch, just take your hand and bring it to your opposite shoulder. And with that, you're gonna hold it for 30 seconds and repeat 3 times. The next stretch that we'll do is gonna be levator stretch. So for the levator stretch, you're sitting up, you're gonna side bend and rotate to the opposite side that you're stretching, and take your hand and apply just a gentle stretch down into the armpit. With that, similarly, you shouldn't have any pain holding that 30 seconds and repeat 3 times. That we'll do is going to be chin tucks. So chin tucks, we'll be sitting down at a chair. And then in a chair, I want you to make sure you've got some pretty good alignment here, and position yourself to where you are pretty much neutral. Bring your chin just a little bit down, so this is more of a slight motion. Try not to excessively create motion, but just a nice slight movement, just a chin tuck. So with that, perform 20 times, 5-second holds. So again, with this, you're not trying to flex your head all the way. I don't want you to bring your chin to your chest, but you're really just creating a nice slight movement. And then in terms of a postural corrective exercise, this next exercise is one I would give a lot of credit to my online mentor, Dr. E, with themanualtherapist.com. So this is one, cervical retractions with overpressure. You're just sitting there, take your web space of your hand, put it on top of your upper lip, and then retract your chin backwards, okay? So you're pushing far and not hard, going posteriorly. And holding 5 seconds, okay? So that one's also 20 times, 5-second holds. All right, guys, so for the next exercise, what we'll do is go through shoulder retractions. Shoulder retractions, I'm gonna have you sit up nice and tall, squeeze your shoulder blades together, hold it 5 seconds, and relax. So you're essentially squeezing your shoulder blades together, going down and back, okay? Holding 5 seconds and relax. Okay? Okay, so today we covered the topic on cervicogenic headaches, some common causes that lead up to that condition, and some self-treatment exercises to treat that condition. So I hope this information helps. Please feel free to leave comments, any kind of questions or concerns down below, and I will get back to you as soon as possible on that. Definitely stay tuned for our next video. We'll cover manual therapy treatments to treat cervicogenic headaches as well. So hope this helps. Again, this is Dr. J. Until next time, you take care.